This example of medication math just hit a social media site for paramedics, and they put this out here as like the simplest, easiest way to do a calculation of dosing. And this makes no sense to me. This looks incredibly complicated and way too much when there's a much simpler method. So what I can tell from this is right here, the desired dose is 10 mics per kilogram per minute, but for some reason they wrote it 10 micrograms divided by kilograms times minutes, which is not the math and it makes no sense. They're also trying to solve for drops per second, and I cannot imagine how this would be useful. Drops per minute, sure, but drops per second, nobody's going to measure it that way. So it's not even a practical example. But then when we get down here, we have all of these multiplication terms here. 200 kilograms times it. I have no idea why they're multiplying everything by 200. 10 micrograms and then divided by kilograms. So you're supposed to multiply and then divide by the same. I just don't even know. The 250 divided by 400 is your dose on hand, also called concentration. But we don't express concentration this way. It's not milliliters per milligram. It's the other way around. It's milligrams per milliliter. So you should get used to putting the drug units on top and the volume on the bottom in order to get your concentration. Converting here, milligrams to micrograms, I get that. I don't know why you want to put an extra term in there like that, but I get it. And then 60 drops per minute is the rating of the drip tubing. And then 1 minute over 60 seconds. I get all this. It's just way too complicated. So let's put this up out of the way and take a look at the way it should be expressed. First of all, your dosing should be mics per kilogram per minute, right? We know that the patient is 200 kilograms, and we also know that we have a bag of 250 milliliters with 400 milligrams in it. So how would I do this if I were ordered to give 10 mics per kilogram per minute on this 200 kilogram patient? Simple. Here's the formula. 10 mics per kilogram per minute. Right there is the formula. So we know we're going to need 10 micrograms, and this is where it's going to get messy. 10 micrograms times how many kilograms? Well, we know we have 200 kilogram patient. And then per minute, we know that we convert minutes into hours because our IV pumps all work by milliliters per hour. And we know that if you're using 60 drop tubing, milliliters per hour is exactly the same thing as drips per minute. So we're going to multiply by 60 because that's 60 drop tubing or 60 minutes in an hour. And then we have to divide by concentration. The concentration is 250 milliliters with 400 milligrams, but the dosing is micrograms. So we have to get rid of the milligrams and turn it into micrograms. We know that 1 microgram or 1 milligram equals 1,000 micrograms. And you can see that right here. They had that up here too. So 1,000. So 400 milligrams is the same as 400,000. So 400,000 micrograms. Okay, so 250 milliliters with 400,000 micrograms in it. And how do we divide? Do we divide the milliliters into the milligrams or the other way around? Well, it's micrograms per milliliter is the concentration, right? We're asking how many micrograms are in a milligram or a milliliter. Excuse me, I keep misspeaking here. Micrograms per milliliter. So you got to put the mics on top of milliliters. So that's going to be 400,000 divided by 250, which is going to get you 1,600. So we're probably talking about dopamine, right? That's a standard concentration for dopamine. And there it is. That's all the information we need. 10 times 200 times 60 divided by 1,600 is 75. And that's going to be either 75 milliliters per hour if we're running a pump, or if you're going with drips, and they seem to want to be talking about drips up here, so it's 75 drips per minute. Same thing, so GTTS over minute. That's as hard as it gets. You just have to remember that your dosing is mic per kg per minute, and that is also your formula. Not that hard. You don't need this stuff. Do it the easy way.
you.